Now we're still looking at the reflexes, and reflexes are responses that actually help us, to be able to access how well, a patient's body is still connected to the central nervous system and all of that. So I want to look at another classification of reflexes, and this one is a superficial tendon reflexes. Superficial tendon reflexes. Okay, so you can see all of that. So for the superficial tendon reflexes, we said that they're actually what? Involuntary responses elicited by gentle stimulation of what? Tendons and skin overlying them. So your body is responding to some one or two, you stimulated, the skin above it. So the nerves are carrying impulses to respond. So they differ from the deep tendon reflexes, like all those knee jerk and the rest of it, which are mediated by cutaneous stimulation rather than a direct muscle, stretch. Okay, so key superficial tendon reflexes that you look at in orthopedics include the plantar reflexes. This one, you are stroking the lateral sole of the foot. Now it will give a Babinski sign. This is the first picture we have here. So negative Babinski sign, this is when the toes go down. The positive Babinski sign, they rather spread out. Do you understand? So that's the difference. So plantar reflex. Then we have abdominal reflex. That one is for the abdomen. You stroke the skin of the abdomen. It could be upper, it could be middle, it could be lower. Okay, so if there's normal, there should be contraction of the abdominal muscles. Do you understand? But if it is absent, if the abdominal muscles do not contract, it indicates that there's an issue. Okay, then we have the cremasteric reflex in males. Okay, if I stroke your inner thigh, okay, mostly in children, okay, your testis should elevate. They should like twitch. Do you understand? So if your testes do not twitch, it shows that there's a problem. So also have the anal reflex, where you now stroke the perianal skin. So normally there should be contraction of the external anal sphincter. Okay, but in some people that have issues in the sacral cord, okay, that sacral cord, there's absence of that reflex. So in orthopedics, most especially, these are the most important superficial reflexes that we look at.